So I've been asked this question before quite a few times. Do people die in the aircraft? That's an interesting question. I think we should just make this like a round table. And I know I'm just talking to you, but if you have a comment about how your program does this or your thoughts on it, please put it below. So I used to say a few years ago, nobody dies in the aircraft, and this adage may still kind of be true. Now there are certain policies for, if you are allowed to get out of your belts to do CPR, do you do that or not? Do you already have a Lucas or an auto pulse on that you could start CPR? Typically we don't call time of death in the air. Now where I work, we have an amazing ECMO program where we actually go intentionally get cardiac arrests and fly them to get put on ECMO at a cannulation site or bring the physician right to the scene and cannulate them. So how we do cardiac arrest looks a little bit different here. So I can honestly say that people don't often die in the aircraft. They're already dead and we're going to try and save them and get them on ECMO. But that's not a resource a lot of the country has. And so a lot of times if a patient codes before they get to the receiving, depending on the distance, the flight crew may continue to the receiving and have them be worked there while they still are actively working them in the aircraft trying to get ROSC, or they may divert to a closer hospital. And it's like, surprise, we have a code, can you help us out? And then the patient will either get ROSC there or they may be called there. And it gets a little tricky with calling time of death in the air because you might even know what county you're technically in, and we need to know time of death for like county, coroner, all that type of stuff, not getting in the weeds. But typically if we have a witness arrest, a lot of times we might know what the cause is, so we will try and do all the reversible things. Is it electrolytes? Is it blood loss? Is it an arrhythmia? And we will still actively try and correct those things, and a lot of times we have a better chance at getting ROSC if it's a witness arrest and we see it happen. A lot of times we can just prevent it because we're actively resuscitating and giving care. So not often that it happens, but sometimes patients do arrest or they go into an arrhythmia suddenly, and we will do our best to treat that in the air and still get them to that receiving destination.